Cases of coronavirus are growing nationwide, and New York State is no exception. Governor Andrew Cuomo declared a state of emergency this weekend to help fund the medical response to the outbreak. On Sunday, he emphasized the importance of keeping perspective.
If you get the virus, you will get sick, you will recover, you most likely won't even go to the hospital. And the only people we really have to worry about are the vulnerable population, senior citizens, people with compromised immune systems. So keep it all in perspective. I know there's a whole frenzy about it. The facts do not justify the frenzy, period.
Now, New Rochelle in Westchester County is just north of New York City, and it is ground zero for the New York outbreak. Noam Bramson is the mayor of New Rochelle, New York, and he joins us now to talk about the situation. Mayor Bramson, thanks for your time today. First, just tell us about the people who have confirmed cases where you are, what we know about how they came in contact with the virus, and of course, how they're doing right now.
Well, according to the governor today, there are 82 confirmed cases in Westchester County. Almost all of those, if not all of them, are in some way related to the initial outbreak here in New Rochelle. One particular New Rochelle resident, who's also an attorney in Manhattan, who is the index patient in this case. The great majority of people who have tested positive are at home, are recovering, have not required hospitalization. But of course, the impact on our community is broader than that. There are hundreds of people who are quarantined as a consequence of this because of potential exposure to the virus. And we should not underestimate the degree to which that is disruptive to their own lives. And of course, layered on top of that is concern for health of oneself, one's family, one's neighbors and friends. At the same time, I want to say that I am enormously proud of the fashion in which our community has risen to this occasion. There has been focus and concern that is proportionate to the challenge that we face, but it has not strayed over into unwarranted panic, which of course is just self-defeating. And I think that the governor's characterization that you played just a moment ago is entirely right. For most people, if you're a healthy adult, the likelihood is that contracting coronavirus is not going to be a life crisis. You will recover. We do have to be concerned about populations that are more vulnerable, the elderly, those with compromised immune systems, and so forth. But if we take common sense guidance from public health professionals, if we remain calm and informed and supportive of our neighbors, then I have every confidence we will face and overcome this challenge.
And the governor's point there that the facts don't justify a frenzy, but as you mentioned, this is still disruptive to effectively everybody as we try and take precautions and keep an eye out for what to do. How are the people in your community holding up who are under quarantine, and what's the economic impact likely to be?
Well, as I said, for those who are under quarantine, it is enormously disruptive. You cannot go to work, you cannot go to school, you cannot have sort of the normal interactions that define our lives. But the level of responsibility and public spiritedness and concern for neighbors that has been illustrated by those under quarantine, by the Young Israel of New Rochelle community, has been really remarkable. I would even say inspiring. There was a message that was distributed by the rabbi of Young Israel to his entire congregation. He himself, by the way, has tested positive for coronavirus. But it was filled with wisdom and perspective and a call for every individual to honor their responsibilities to their neighbors. So, look, no city would ever want to face a circumstance like this. No individual would ever want to face it. But I think New Rochelle can be proud of the strength and the resiliency that so many of our residents have exemplified.
And that at least shows what's happening on the kind of messaging level. But what actions is the city of New Rochelle taking right now to prevent the further spread of the virus in the community beyond the quarantines you've mentioned?
So to be clear, in Westchester County, municipalities do not have a public health function or apparatus. So we largely take direction from county and state officials who do have public health expertise. We work collaboratively with them. The state has established an emergency operations center in New Rochelle, which essentially functions as a staging area to promote and assist with monitoring and testing for the virus. The state has also directed that nursing homes and assisted living communities within our city disallow visitors. That's a means, of course, again, of protecting the most vulnerable among us. And we are collaborating with the state and the county pretty much round the clock in order to assist in communication, both targeted basis to those who are under quarantine and more broadly through our community, to make sure that everyone has the facts that they need in order to protect themselves and their families.
How likely are school closures?
That's difficult to judge. Up until now, the judgment from both our school district and from the state health professionals with whom they consult is that there's no public health reason to close our public schools. But we all acknowledge this is an evolving and fast-moving situation. Things change not only by the day, but by the hour. And so everyone in a position of public leadership has to be flexible enough to constantly reevaluate and determine what is necessary. But at least as of now, there's been no need to close our public schools. I've got 2 kids who are students at New Rochelle High School, and they're going to be showing up at school tomorrow morning in order to get a good education.
All right, we appreciate you walking us through the latest information. I'm sure your phone is ringing and your inbox is full, so we value your time today. Mayor Bramson, thanks very much.
Thank you. Good to be with you.